Good morning, my name is Jelena John and I'm going to talk about what are hormones. An hormone is a chemical released by one or more cells that affects cells in one part of the organism. Only a small amount of hormone is required to alter cell metabolism. It is essentially a chemical messenger that transfers a signal from one cell to another.
Is associated with a G protein that is comprised of alpha, beta, and gamma subunits. The peptide hormone assumes its active configuration, fits onto the receptor binding site, and conveys its message. The message results in a conformational change in the receptor that is transferred mechanically to the G protein.
An hormone signals by the synthesis of a particular hormone in a particular tissue, storage and secretion of the hormone, transport of the hormone to the target cell, recognition of the hormone by associated cell membrane or intracellular receptor protein, relay and amplification of the received hormone signal by a signal transduction process. This then leads to a cellular response, degradation of the hormone.
G protein-linked receptors use a chain of other proteins.
In the case of a protein kinase cascade, one cell surface receptor activates many G protein molecules. Each G protein activates many adenylyl cyclases. Each cyclic AMP in turn will activate protein kinases, which then activate several molecules of a specific. The end result is rapid production of high levels of the final product.
Interactions with receptor. Most hormone initiate a cell response by initial combination with either a specific intracellular or cell membrane associated receptor protein.
Chains of amino acids. Because peptide hormones generally consist of short chains of amino acids. Because peptide hormones are often quite short, they lack a rigid three-dimensional conformation and are flexible. Peptide hormones are usually
Type of hormone. Protein hormone. These comprise amino acids. Those that are the only several amino acids in length are called peptide hormone, whereas largest ones are called polypeptide hormones. They include insulin, glucagon, and leptin.
The circulation to all body cells. Once absorbed, rise beta cells, which respond by secreting the hormone insulin into the circulation,
causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary.
Effects of hormone: stimulation or inhibition of growth, induction or suppression of apoptosis, regulation of metabolism, preparation of the body for mighty fighting, fleeting, and other activity, control of the produce cycle. Physiology of hormones. The classic hormones produced by cells in the endocrine gland mentioned so far in this article are cellular products specialized to serve as regulators at all overall organism level. However, they may also exert their effects solely within the tissues in which are produced by original release.
And causes opening of the cation channel. Opening the cation channel allows extracellular cations, such as sodium, to enter the cell. The diffusion of sodium into the cell results in a localized depolarization of the cell membrane in the region of the channel. Polarization spreads across an area of the cell surface. Since this is only a hypothetical model to explain G-protein signaling, the depolarization is presumed to produce an important physiological response within the target cell or to signal other cells.
Pros: no interruption of foreplay or intercourse, reduce pain during ovulation, reduce fibrosis, breast change, may reduce ovarian cysts, can be used after abortion. Cons: does not protect against sexual transmission infections, may not be effective when taken with certain medicines. If used in early breastfeeding, may reduce milk supply. Pills must be taken daily. Application in medicine. Hormone is a therapy and refers to any external combination strong. Strong therapy is the most highly effective prescription medication for treating menopause symptoms. Other safe and effective non-hormone medication exist to address a woman's concern regarding osteoporosis.